Another way of increasing the amount of neurotransmitter in the synaptic cleft is to block the metabolism of serotonin, norepinephrine, and dopamine after reuptake, which is accomplished by MAO inhibitors, monoamine oxidase inhibitors. And remember that MAO is an enzyme that catabolizes monoamines like serotonin, norepinephrine, and dopamine. So, inhibiting it increases the availability of monoamines for release. So, this concentration will go up. And obviously, those monoamines are serotonin, norepinephrine, and dopamine. The MAOIs are another very old class of drugs, and they include tranylcypromine, phenelzine, isocarboxazid, and selegiline. The last one, selegiline, is actually a selective MAOB inhibitor, and it'll be discussed in more detail when we go through Parkinson's medications in the neuro chapter. The mnemonic that I like, and for all you history buffs out there, is Mao takes pride in Shanghai. So MAO, Mao, takes pride in Shanghai. Clinical uses include atypical depression, anxiety, and hypochondriasis. Toxicity is that they can cause a hypertensive crisis when they're mixed with beta agonists or tyramine. Beta agonists or tyramine, which can be found in many foods, classically wine and cheese. This is a very high yield fact to remember, as many test questions will feature a patient with depression going into hypertensive crisis after eating some cheese and drinking some wine. So, in addition to taking pride in Shanghai, Mao does not like wine or cheese. Also remember that MAO inhibitors can increase the levels of serotonin and can increase the possibility of serotonin syndrome if they are mixed with drugs like SSRIs, and therefore it's contraindicated to use the two together. We've covered most of the commonly used antidepressants, but there are three more that don't fall into the classic drug classes, but still may appear on your boards. They each have something distinct about them that makes them boards friendly, and the first one is bupropion, which is an antidepressant that causes an increase in norepinephrine and dopamine, but it's through an unknown mechanism, which means you won't be asked how it works. It's used for smoking cessation. And the key fact about bupropion is that it doesn't cause sexual dysfunction. So patients who are doing well with SSRIs but are suffering from anorgasmia or decreased libido may want to try bupropion as an alternative antidepressant. Other toxicities are more nonspecific, but include stimulant effects, headache, and seizure in bulimic patients. The stimulant effects include things like tachycardia and insomnia. And the reason it causes seizure is because it's known to decrease the seizure threshold in bulimic patients, and therefore it's contraindicated in this group. The next drug, mirtazapine, is an antagonist at the alpha-2 receptor. And this actually causes increased release of norepinephrine and serotonin because it's blocking negative feedback at the alpha-2 receptor. It also antagonizes the 5-HT3 and 5-HT2 receptors, which also causes increased release because it's blocking that negative feedback. In terms of toxicity, mirtazapine causes sedation, increased appetite, weight gain, and dry mouth. Basically, mirtazapine can make you fat and lazy and feel like you have cotton in your mouth. The first of these, sedation, though, is actually a side effect that's used for people with insomnia, and why mirtazapine is sometimes a drug of choice for people with depression and insomnia. Trazodone, it's actually a step 1 favorite, and it works by inhibiting serotonin 2 and alpha 1 adrenergic receptors, therefore limiting feedback inhibition. While theoretically this makes it a possible treatment for depression, the dose required is often too high to be well tolerated. So incidentally, it's become more commonly used for one of its side effects, and that is sedation in patients who suffer from insomnia. Other toxicities include sedation, nausea, priapism, which is why trazodone is sometimes referred to as trazobone, and postural hypotension. And remember that anything that increases serotonin could theoretically cause widespread vasodilation and therefore postural hypotension. Okay, true or false, bupropion causes sexual adverse effects? Answer is false. It does not. Remember that bupropion is a feasible alternative for depressed patients that become frustrated with the sexual side effects of other antidepressants. Alright, let's test ourselves with a USMLE style question. A 35-year-old man is being treated for chronic depression and schizophrenia. He begins to develop muscle rigidity and motor restlessness with a stooped posture and shuffling gait. These adverse effects are most likely the result of which of the following medications? A. Amitriptyline, B. Chlorpromazine, C. Fluoxetine, D. Risperidone, or E. Trazodone. The correct answer is B. Chlorpromazine. The patient here is experiencing extrapyramidal side effects from antipsychotic use. The medications most likely to cause this are the high-potency neuroleptics, like haloperidol, but the low-potency ones can cause it as well, such as chlorpromazine. The extrapyramidal side effects are thought to arise from dopamine receptor inhibition in the nigrostriatal pathway. Now let's look at why the others would not be correct. A is not correct because amitriptyline is a TCA and would not cause Parkinsonian symptoms because TCAs don't block dopamine receptors. They're more commonly associated with anticholinergic effects. C is not correct because fluoxetine is a SSRI, which doesn't block dopamine receptors. SSRIs cause adverse effects like tremor. D is not correct. Although risperidone is an antipsychotic, it's an atypical antipsychotic, and these have less frequent and severe side effects from the typical antipsychotics such as chlorpromazine. E is not correct, trazodone, because it's a heterocyclic antidepressant, which inhibits serotonin and norepinephrine uptake. And this doesn't affect the dopaminergic system. Adverse effects of trazodone include postural hypotension and priapism. So that's it for Psych Pharm. I'll see you in the next section.